but we already have a different kingdom of medicine like animal, plant, mineral, imponderabilia. But the nosode is very much unique to our system. That's we are preparing medicine from noxious substances or disease objects. And I think no other system or other therapeutic system have this kind of medicine. Okay, I think I can discuss more about today and
Right.
about the experience too with the nosodes. And actually, we people very love nosodes than any other group of medicine like mineral or plant or animal, and it is very easy to prescribe and understand, and its action is very much what to say, is a guaranteed about the action of nosode. The sphere of action is guaranteed. Okay, I think I can share my ideas, and after that
Yes, yes,
we'll
definitely,
be
definitely.
confident about it.
We
It's
are
uploaded now,
actually
it's
looking,
showing us
yeah,
converting, doctor.
converting. It'll just take another minute or so. Actually, we are very looking forward to this because there's not so much of literature as Jan was saying on nosodes. There's not so much of information. So it is always nice to hear from people who use nosodes in their day to day. What I've heard of nosodes is that it's used more as an intercurrent remedy.
Yes, yes,
That
yes.
was what we initially heard. I mean, now, of course, we are going to learn a little differently, I think.
Yes, now it's what to do, doctor. It's
Now you just you click on that file,
conversion
whichever
is
file.
over. What to do
Over.
next?
Now you can share that file.
How?
Let me see if it's uploaded. Yeah. Okay.
Yes.
Let me start it for you. Then you can control it from there.
Okay, okay.
You can use your right arrow or the left arrow to move up. Can you just move the
Is it
slide
up?
and see how it? Yeah,
Is
it's
it
already
uploaded?
up.
Doctor? Uploaded?
Yes, it's up and sharing.
Okay, okay, okay,
I've also started sharing it. Can you use your right arrow to just see if the slides are moving? You can move the slides.
okay. Yeah. Okay. Is it audible? Is it
Yeah,
visible?
yes, we can see you. Is everybody else able to see the screen with the nosodes? Let me check in the live. Yes, I think it's there on the screen. I can see it on Facebook. We are also live on Facebook, and I think now just a small introduction about Dr. Wahab and where he comes from. Dr. Wahab is one of the main teachers in Sahia, and you all know that I've been talking to you about Sahia every month. Sahia is an organization I admire because it's one of the organizations which is mainly for sharing knowledge among homeopaths. And the idea is that when you need to be serious because what they do is serious business. They are interested in identifying homeopaths who are keen in developing their knowledge. They have a year-long course, I think, where you need to apply for, and then they have a system of identifying who they take on. But if you ever get the chance, you sign up for them for their courses or join their Facebook group. It's been run by Dr. Biju, who's done yeoman service in homeopathy for Kerala. He was also recently awarded the best homeopathic doctor in Kerala by the health minister of Kerala. And so Dr. Wahab also comes from Sahia. He's one of the course teachers, right? Dr. Wahab, what do you call yourself? I mean,
Trainer,
what do
trainer,
you, trainers? Yeah.
trainer in
So
task.
Sahya Jan, it's Sahya. They have a large Facebook group which has got about 4,500 people. So with this, I'd hand over the mic to Dr. Wahab, and really excited to hear what he's got to say. Okay, Dr. Wahab, all yours.
Okay, thank you, Dr. Karthik sir, for this wonderful opportunity. So, good evening, dear friends. I think it's night here. Okay, so nosodes in homeopathy, and I think all are familiar about nosodes. And I already said about the homeopathic kingdom of medicines like mineral, plant, animal, nosodes, sarcodes, and imponderabilia. After which, nosode is very unique to homeopathy. And today I'm going to explain or share my ideas about nosodes in a very short, because 1 hour is very short to express the ideas about nosode. Okay, so my mentor, actually, Dr. S.G. Biju, it was mentioned by Dr. Karthik, is the founder of our training school, Sahya. Actually, Dr. S.G. Biju, he is my mentor, and he taught me everything about homeopathy and about practical homeopathy. And even this module, No Sword, I had developed from his ideas. What I am sharing, about 99% of ideas about No Sword are perceived from this great man. He's my mentor, and I'm very proud of being him. And we team Sahyas are very proud of him. He is the chief patron of Sahya, and he's my mentor. And this entire module is developed by from his ideas and experience. Okay, so about nosode, and I already said about the nosode. Nosode means we all are very much in Kerala and in every part of the world. The homeopaths are very confident about nosodes. You know why? Because we don't have any hesitation to repeat nosodes while we prescribed once. Like we have the tendency or the hesitation to repeat the medicines when we are using it from the animal kingdom or the plant kingdom or mineral kingdom. But we are very confident about a nosode. Okay, so that's the uniqueness of the nosode. And we can have a look on which are the areas where the nosodes coming into play, or which are the areas in our clinical daily practice that nosodes have some advantage over other kingdom of school. Okay, and we can have a look on it. Okay, and the first one, the nosode, is to the indication to prescribe the nosode as a constitutional homeopathic remedy. Like all other medicines, like calcarea carb, like pulsatilla, like argentum nitricum, every nosode is a personality, is a different clear picture personalities are like medorinum, tuberculinum, carcinosin, syphilinum, sorinum, all are all have a peculiar characteristic like that of other remedy like natrum or ignatia. So first indications of the nosode in our clinical practice is as a constitutional homeopathic remedy that we know. Okay, and the second point is that, okay, just wait, and this PowerPoint is little bit slow in uploading. Okay.
It's already come up, Doctor.
Okay,
Okay.
I can see here. And when well chosen remedy fail, or when well chosen remedies do not hold for the case for a long time. Okay, and what it means when we are that we are call it as a intercurrent medicine, that Karthik doctor initially said that no source are using as an intercurrent medicine. Okay, when a well chosen remedy do not hold the case for a long time, we can give any of the medicines like sorinum, tuberculinum, medorinum, or syphilinum according to the need of the case, and we can remove that block. This usually is caused by a miasmatic block. And the third one, when there is a paucity of the symptoms. Do you know what you mean paucity of the symptoms? We are sometimes in our clinical daily practice, we are facing, there are cases, but only there is paucity of the symptoms and the cases is not clear. So to clear up that case, we can give any nosode according to the need of the case, and that will definitely clear up the case. Okay, then we can select a medicine according to the current totality, and that is one of another field of nosort. Okay, and then the next one, when a person suffer from a specific dyscrasia of a particular disease, that is very, we know that about the utility of the carbo-veg, right? We are using the carbo-veg if there is any dyscrasia after acute or chronic disease. Actually, carbo-veg is not a nosort, it's a mineral origin. But for example, in a case of typhoid, if a person has a specific dyscrasia or weakness after typhoid, we can use typhoidinum as a medicine to remove that dyscrasia. That's only a peculiarity of the nosol. Okay, specific typhoidinum. If a patient has gonorrhea and if it is what to know suppressed by any faulty method of treatment, the patient may have memory weakness or lack of stamina or weakness, all the loss of the rigor, then that patient require a dose of metorinum, because that specific dyscrasia caused by gonorrhea will be cleared definitely by a dose of metorinum. Similarly, all diseases, the variolinum in smallpox and the diphtherinum in case of diphtheria, these all are nosol. So a specific disease is occur, we call it as a never well since syndrome, never well since typhoid, never well since diphtheria, never well since gonorrhea. We can use diphtherinum, typhoidinum, or gonorrhea, medorinum, respectively. Okay, so that's about one of the character. Okay, and the next one, this is the most important diagnostic point of nosol. That is, when a distorted image of a constitutional remedy is present. Okay, that means while we are analyzing the case, we take the case, we have the totality of the symptoms. But when we are analyzing the case, some symptoms are suited to ignatia, some symptoms are suited to pulsatilla, some suited to natremor, some suited to phosphorus. That means there's a cluster of symptoms and that's suited to different remedy, but not fit to a single remedy. So what to do? In that case, we can use a nosode. And this pattern is the quiet diagnostic of a nosode as a remedy. Okay, so when a distorted image of a constitutional remedy is present, it not no one remedy completely fit the case. And this is, remember, this is the definitely a diagnosis of a nosol. Okay, and the next one, when a fundamental or dominating miasm obstructing the efficient functioning of a constitutional remedy. Let me to explain. We have a case and we prescribed a case according to the totality, and the case cleared and patient was well cured. And after several months or 6 or 8 years, patient come back with the same symptoms. Usually what will we do? We will prescribe the same constitutional medicine, but the result is ineffective. That means that remedy once acted is not giving any result. Why? But the symptoms are not changing. The symptoms are not, this is the same and is not calling for another remedy, but still that medicine is not acting long. That means that first constitutional medicine is apparently ineffective. And this is the area of the homeopathy. That is a cause of the release of the main theory, the beautiful theory in the history of the medicine, miasm. Actually, that's a fundamental block. So the medicines like sorinum, medorinum, syphilinum, tuberculinum can remove that block to clear the case. After removing that block, either this nosode or the initial constitutional remedy may finish the case. Otherwise, that initially acted well chosen remedy didn't give any result. That's we are witnessed in our practice. So that's the uniqueness of nosodes. Only nosodes can do that. Either any complementary or any follows well track can't give that actions. Only the nosode, because there is a fundamental block. That means a miasm. That's unique to our homeopathy. That's our cup of tea. Only our cup of tea. Only homeopathy can do it. Okay. And the next one, as a genus epidemicus. Okay, for example, we can use meningococcinum in epidemic of meningitis. The meningococcinum is producing from the noxious substance of the meningitis. Okay, so we can use it as a epidemic in a epidemic of meningitis. Okay, and we can use the nosode as a prophylaxis to prevent infectious disease. For example, in the history, the Burning has used variolinum to prevent smallpox. Variolinum to prevent smallpox. And even in the COVID season, and here in India and Kerala, we are using asal as a prophylaxis, but here we are using the term immune booster because of political reason. But anyway, and sometimes that was any discussion that influenza is a better choice. Why? Because the nosode has always have a better action as using as a prophylaxis, and the history too, the Burning has used it. So that's about the using of prophylaxis. And another cup of the tea of the homeopathy, that is to use to protect the children from the malefic action of parental or hereditary miasm. What it means? We know about the inherited miasm. If a newborn get inherited miasm, either psychosis or syphilitic or psychotic or syphilitic, psychosyphilitic miasm from the parent, is a higher possibility to develop such kind of infections or diseases in that inborn child. So to remove that dyscrasia, we can use medorinum if the inherited miasm is psychosis. We can use syphilinum if the inherited miasm is syphilitic. We can use carcinosin if the inherited miasm is psychosyphilitic. Okay, and this only homeopathy can do it. Maybe in the recent or in the coming era, if the genetic engineering has developed, if it incorporated to the medical field, they may have the chance to clear up the upcoming diseases. Otherwise, apart from the vaccination, they can't prevent the disease. Only homeopathy can. So the proud of being a homeopath, and only homeopath by this nosode, or we can use the term, better use the miasmatic prescription. We can use this nosode to prevent the inheritance of the disease or the development of the disease due to a inherited miasm. This is not a new thing or a new development of theory. We have that example in our literature. In lectures on homeopathic materia medica, our J.T. Ken has described, this is his word, if the tuberculinum bovinum be given in 10m, 50m, cm potencies, 2 doses of each potency at long interval, all children and young people who have inherited, look to that word, inherited tuberculosis, may be immune from their inheritance, and their resilience will be restored. That means at that dyscrasia is restored. Okay, look at that word, inherited tuberculosis. That means that if the tubercular miasm is inherited to the child, we can save the child from the development of the tubercular diseases by giving a dose of tuberculinum 10m, 50m, cm in 2 doses of each potency at long interval. That's a remarkable to our system. Okay, so I think it's clear to you. Okay, and the next one, the using the nosode as a homeopathic remedy from the patient's own disease substance. It is very uncommon. We are not using nowadays because we have plenty of medicines now. Okay, if you are preparing a medicine from a substance or secretions of our own patient, that is known as autonosode or isode. We can see the example from the history. For example, our master, Dr. Samuel Hahnemann, has done this autonosode in one of his patients. That a phthisis patient, it was not, he tried every medicine, apparently all medicine, but it didn't give any result. So what he did, he take the saliva of that patient and potentize and give to that patient. That is known as autonosode or isode. That's the coming era of the nosode, which may develop or may be unnecessary because of the plenty of the medicines already we have. But it's another area of the nosode that have to be developed. Okay, so just remember, just take it into mind only for an academic interest. Autonosodes have been made from the sputum, blood, urine, pus, leukorrhea, or exudation from skin eruptions and microbes from the cultures of the patient. Okay, simply a noxious substance from the patient can potentialize and use as a medicine for that patient only, right? That patient only. That is known as otonosol or isoniazole. Okay, so that's about these peculiarities or the areas of the nosodes that's coming into play, or the area where we have to think about the nosode. Okay, typically remember one or two statement that I made means if you get a distorted images of, while you take the case, you get the distorted image, you can think about a nosode. Or to prevent any development of the inherited miasms development, you can prevent, we can use the nosode. Okay, this is about the nosode. I think you are clear. Now we can, because our time is too short, we can move to some of the polycrust nosode. And the first one is the carcinosin. Carcinosin. Okay, and the carcinosin is a very interesting medicine. My mentor, Dr. S.G. Bichu, always said this carcinosin is the era of this medicine, because carcinosin is a psychosyphilitic, and this era is psychosyphilitic, no doubt. Okay, no doubt. Okay, and Biju sir said always the tuberculinum was the medicine of the previous era, and now it's shifted to carcinosin. Okay, now we can look to the pathogenesis of carcinosin. I use the word pathogenesis. Okay, why I use the pathogenesis? Every remedy have a pathogenesis. It's very unique to a medicine. For example, we know rheumatoid arthritis and osteoarthritis. Both conditions have joint pain. It is similar. But when we are looking to the pathogenesis, it's different. Because in rheumatoid arthritis, what happened? It's actually initially is an autoimmune inflammation that causing the synovial hyperplasia, then the joint destruction. That's an inflammatory, that is rheumatoid arthritis. But in case of osteoarthritis, the pathogenesis is different. Where is the synovial fluid is first disturbed, then the subchondral bone, then the bone destruction occur. That means pathogenesis is different. Even the symptoms are same, and that peculiarities are we are used to diagnose the case by using the blood parameters. Because of the autoimmune history in RA, we can find out rheumatoid factor or ACCP. But in osteoarthritis, we can't see the ACCP or rheumatoid factor. Okay, RA factor. So that means to diagnose a disease, we are using the knowledge of the pathogenesis, not the symptomatology. Similarly, all remedy have a common symptomatology, but every remedy have a different pathogenesis. If you are trying to understand the pathogenesis, the materia medica is very interesting. To remember every symptoms of all medicine is impossible for a normal, average, intelligent people. Because only for a sulfur that have more than 5,000 or 10,000 symptoms, how can we remember all these symptoms? Instead, if we know the pathogenesis of the sulfur, pathogenesis of the phosphorus or pulsatilla or carcinosin or medorinum, it is easy to diagnose the medicine, diagnose the remedy, whatever may be the symptoms. Nowadays, we have the plenty of the software that help us to find out the symptoms of the medicine. But I think no softwares can identify a pathogenesis of the medicine. That we have to understand. So in short, I am going to make a note on how the pathogenesis of the carcinosin, how the carcinosin personality has developing. Okay, the 4 causations are there. The first one thing is the prolonged history of unhappiness, which means what? Prolonged history of unhappiness means suppression, maybe a sick marriage, maybe a strict parental domination, strict parenting. That means restricting all her freedom or all his interest. She is just sacrificing all his desires and loves for the sake of the family. If a lady is living like that, that means the development or the pathogenesis of the carcinosis is going on. And the second one, the prolonged history of anticipation, which means what? Anticipation. If you just let me to explain. If my boss is very strict and my boss has the habit of punishing me for everything what I've done, then what will be in my mind every time when my phone rang? I feel, my boss is calling to reprimand me, to abuse me. So I'm living for the entire hours of life, entire hours of the day by this anticipation. Or next one, the prolonged history of a fear and fright, how it develops. And if a child is abused sexually from uncle or the neighbor in the childhood abuse, what will be in his her mind when he hear the sound of that uncle? She get feared. Oh, that uncle will come and abuse me or torture me. But at the same time, she don't have the courage to share that to her mother or parents. That means she's living in that anticipation, sort of fear and fright. And the last one, the prolonged and history of parental domination. That means a strict parenting. And India, that is very common. That is, the parent will decide what is the career of the child. Parent will decide what the dress the child will wear. Parent will decide what kind of the food the child will take. That means all her freedoms are that's removed by the parents. They are strict parenting. So in short, if it is the prolonged history of unhappiness or the anticipation or prolonged fear and fright or prolonged parental domination, what happened? She is a tremendous stress. If it is happening in a patient, that is means the development of the carcinosin pathology is happened. How can we collect it? Simple. While we are taking the case, you just ask about the state of the patient or about the childhood of the case, childhood of the person, about the life state or life position. We can clearly get the picture of his past history, not only the disease. Sure, it's important, but about the person diagnosis. And all this, if these four symptoms are there, it's guaranteed that the patient has the tendency to develop all the symptoms of the carcinosin, or the carcinosin pathogenesis occurred in that patient. Okay, and the Dr. Banerjee sir has used the word the doormat. He compared the carcinosin to doormat. Why? What's the peculiarity of the doormat? The doormat is nothing. The doormat receives all the dirts of the people that passing. All the passing people will deposit the dirts on the mat. Similarly, carcinosin will receive all the punishment, all the sacrifices, all the pain from the parent, lover, husband, or the boss, and still she keeps a smile for the sake of the family. So sometimes it may be very astonishing. How can a lady can smile like this, even with this kind of the bomb inside? That is the peculiarity of the carcinosin. You just imagine how a cancer cell is behaving. If a proto-oncogene is activated, a malignant affections happen, even for a short time, that cell is confined to the particular part. After several times, it gets detached and deposited to another part that is called as metastasis. Similarly, a carcinosin personality will always suppress everything, all pain, all sufferings, and suppress all the dreams for the sake of the family, for the sake of the happiness of the family, for to smile or to keep her child happy. I think you are clear about the pathogenesis of the carcinosin. Okay, and we can look about the identification points of carcinosin. That is the fastidiousness. You know that what is fastidiousness. Fastidiousness is also seen in another medicines like asal, anaxomica also. How to differentiate this fastidiousness of carcinosin and asal? Very simple. In asal, this fastidiousness is a neurotic one, neurotic fastidiousness, because he has the fear of the disease, fear of the contagion. So he will be fastidious even in the bathroom, asal. But in carcinosin, why she become fastidiousness? Because of the fear of the punishment. To make the parent happy, to make the husband happy, to make the boss happy, to get escape from the punishment or the reprimand, she become a fastidiousness, or she keeping fastidiousness. That's the difference of the fastidiousness of asalba and carcinosin. So what about Naxomica fastidiousness? We know Naxomica is a performer. Naxomica want to be the topper. Naxomica is want to be the perfect person. So he want to be the perfect and the performer. That's why he become fastidiousness. Not because of the fear of the disease or fear of the contagion like Asal, or not like to impress her parents or the boss. Instead, Naxomica to do to become the most attractive person, or to become the best person type of personality. That's about the fastidiousness. That's one of the identification point of carcinosin. And the next one, the Caffele moles. That means hemangioma or Caffele spots are appear newly in the body. That is an indication of the development of the psychosyphilitic miasm. Okay, so it's a guaranteed indication of a carcinosin. And the third one, the ideal or model child. What it means? A carcinosin child is very precocious. That means he's very punctual, is a very clear in studies, and do everything in a perfect manner like an adult. That is an ideal or model child. Everyone like that child. Oh, how mature your child is. Actually, it's saying nature saying that that child is psychosyphilitic miasm. That means that child needs a carcinosin when he become sick. Okay, so that's about carcinosin. Okay, and another identification clues of carcinosin are sleeplessness, insomnia. Look, insomnia either at the present or in the past or even during the childhood. If you get a suspicion about the possibility of a carcinosin in a patient, you ask whether you have insomnia, whether you had the insomnia. If that patient has insomnia in the present or in the past or even during the childhood, is enough to confirm the possibility of a carcinosin. And then next one, the history of the several infectious disease in childhood. Some child may get infected with mumps, chickenpox, measles, and scarlet fever, like all kind of infectious in the childhood. That means it's saying that that child is a carcinosin child. Several infections in the childhood. And another very positive symptom is the love for animals and nature, loves music and dancing. Love for animal, that's a peculiar of carcinosin. They're animal and nature. They are fond of animals and nature, love music and dancing. Okay, so that's about carcinosin. Then another confirmatory point of carcinosins are blue is discolorations of sclera in children. Actually, it is a symptom of osteogenesis imperfecta. Okay, but still, it is the bluish discolorations of the sclera. When we are looking to the eye, we can see a bluish spot around the cornea. That means in the sclera. Okay, and the passionate love to children. I already said about the fond of love and nature, love music and dancing. That is a romantic person, and passionate love to children. Okay, and the next one, the complaints after taking responsibilities during younger age group. Younger age group. Okay, that I already discussed about parental dominations and etc. Taking responsibilities during younger age. That means suppression, lot of suppressions will be there. And the moles in crops, a Caffules spot. If a patient is saying that I had developed new moles in my skin, that means the psychosyphilitic miasm is the dominant in him. That means the carcinosin is he. Okay. And next indication, hereditary cirrhosis, anemia, and the maternal side carcinoma, the cancer. If you are taking the family history, if there is a malignant affections or the cancer history, that is a confirmatory point towards the carcinosin. Why? Because the cancer miasm or the psychosyphilitic miasm is predominant in that family. And the next one, destructive symptom, the tearing the skin around the nail. Tearing the skin around the nail. That is a syphilitic one. Not biting the nail. That is a symptom of medorinum. here tearing the skin around the nails. That's about the carcinosin. Okay, so that's about the carcinosin. I talked about its how the pathogenesis is developing. That is the suppression and the identification points like blue discolorations around sclera and capillus spot, moles in crops, and malignant history in the maternal side, especially in the maternal side. Okay, that's about carcinosin. Now we can move to syphilinum. That is, from the name itself, it is an representative of a syphilitic miasm. Okay, in syphilinum, that is aversion to every dirtiness, especially of the hands, and always washing the hands. Even the syphilinum patient has fear to give shake hand because of that kind of contamination, the syphilinum. Okay, and the recent memory lost but active remote memory. Okay, recent memory loss, but active remote memory. And when looking to the teeth, you can see a spotted discolorations on teeth and washing underclothes frequently. That kind of obsession at the extreme is there, obsession underclothes and frequently. Dreams of his own disease, dreams of his own disease. And just as no expressions on the face. Why? Because syphilitic one, destructive. Syphilitic miasm means a destructive. Okay, so that's about the syphilinum. And history of abortion. Abortion means what? Is the end of a species. That means a syphilitic miasm. So if you get the history of abortion in a patient, that's saying, the nature saying that that lady is a syphilitic, has a syphilitic taint. So it's very cruel if we are not prescribing syphilinum to that lady. If you are giving syphilinum to that lady, it means you are saving that family from the happening of the more abortions. Okay, that's a syphilis. If the syphilitic miasm is predominant, the next will also get aborted. But if you give a syphilinum vanum, the abortion, the tendency to abortion will be removed. That's only homeopathic remedy can do that. Okay, so that's about. And chronic ophthalmic pathologies, that is only chronic eye pathologies, or the astigmatism or the retinal detachment or any chronic ophthalmic pathologies is coming under syphilitic miasm. So syphilinum can be coming into action in the case of chronic ophthalmopathic diseases. Okay, and the identification clues, physical identification clues. And deep longitudinal crack along the center of the tongue. While examining the tongue, we have different kind of tongues are there. Deep longitudinal crack along the center of the tongue. Okay, and nails are distorted. Why? Syphilitic patient, destructive one. So nails are distorted. Remember this: in syphilinum, nails are distorted. That means in shapes are lost. Shapes may be lost or broken, or that means what to say? Everything distorted. Okay, and hereditary illness, and especially all the conditions, like the Graves condition, grievous diseases may be happened in their family. Hereditary illness, that means a syphilitic miasm is transferring. And striking himself, and alcoholism and antisocial. These about all are the identification points of the syphilinum. Okay. And the next one of the important one, that is medorinum. We all are aware about psychotic miasm very well, and the medorinum is the best example to study the medorinum. Okay, I'm not going to deep to medorinum because still 2 hours or 3 hours we can talk about medorinum. Okay, but I'm going to only the identification points of the medorinum. That's our topic today. Okay, children cruelty, not children towards the cruelty. The children is cruel. How? For example, if you're handling with the child case, when asked to the child, in the first visit, the child will be very talkative about his pet, that his cat, his name is that, and I will play with the cat, or I will play with the dog, and will be talkative about the pet. So we have the memory that that child has a pet and is fond of pet. And the next visit, while we are asked, what happened to your pet? His reply, died. So how it died? I killed it. Okay, so that's his response. That is cruelty to animal, or to throw stones to the dog. or like pulling the wings of the insect and to watch the moving of the insect, or kick the cat. Actually, in a child, what we are expecting is some kind of fear to animal. But if the Medorinum is a child, he don't have that kind of fear. He always torture the pet or the animal and have a pleasure on it. That is the cruelty towards animal. Okay, that is children, cruelty seen in children. That is an identification point of Medorinum child. And next one, extreme polarities. That means the Medorinum have the polarity. That means extremes. Uh, that that means once we can see that he's very expressive, agony, anger, fear, and everything is expressing. And after few days, when we are looking, he's like a person is like very gloomy. He's not expressing anything. So we are, oh, this man has a personality disorder. No, actually, he is like that. Medorinum is like that. It is not a mood swing like we are seeing in Natrum or Ignatia, Nux moscata or Crocus. It's not a mood swing. The Medorinum personality is like that. It's a swing, the extreme. Either very topper in the exam or get failed in the exam. Okay. Or the biggest performer or the high performer in the team or in the company, or the loser in the company. That is the both extremes. That's why Shankaran sir used the word pendulum, like a pendulum. Extreme polarities, alternating states. Just remember that identification point. That is extreme. Remember, it is not a mood swing. It is not a mood swing. They are like that. Sometimes very expressive, sometimes very introverted, sometimes they are not expressing anything, but sometimes very sometimes expressing and very like phosphorus or like that, sometimes like Natamor. But he is not Natamor or Pulsatram. He is Medorinum, alternating state. Remember, want to say again, it is not the mood swing. They're actually like that. So that's about Medorinum. Okay. And this lady is her name is Jolie, and Carolite know very well about this lady. Her name is Jolie, and in Kodathai, it's one of the in the place in the district. He is one. What he did is very malicious. She killed 6 people in her family: her wife, her husband, her in-laws, her cousin sister, and with related, and about 6 people. And you know what's the peculiarity? He started this killing in 2002, and it get discovered or get into the public domain only in the 2017, 2018. That means after 16 years, she killed all her relatives by giving cyanides. The way of the killing, look to the way of the killing, and how she concealed it, how she escaped from the prosecution. That is a psychotic. Look to her lip, thick lip. That's one of the identification. That's why I use it. Identification points of the Medorinum: thick lip and eyebrow, some kind of unibrow. Unibrow is there for her. So that's an identification point of Medorinum. And she's now under persecutions in Kerala. She's under is imprisonment now. It's a famous case in Kerala, notorious case in Kerala, Kudathai Jolie. Okay, so is Medorin, the maliciousness. And another person, look to this person. His name is Suraj, and that's his wife, Uttara. Can you know what he did is that he killed his wife by a poisonous snake. He tried it 3 times. 2 times that lady escaped miraculously, but he didn't give up. He put a poisonous snake into the bedroom and allowed to bite his wife. Look to the intensity of the maliciousness, and look to his lip too, thick lip. The natural is saying that the Medorinum or the psychotic miasm is there. And for killing, there are plenty of options are there. For a criminal, we are witnessing daily in all the printer media. witnessing it, that various kind of the what is a cold-blooded murder. But what Jolie, the Kudatai Jolie and this Suraj did is the maliciousness. Why? Because they are metorinum, because there is the psychotic tint is more predominant in them. Look how beautifully explained our miasm even centuries before by our masters, Hahnemann and our other masters. That's the beauty of our miasm. Even still, it's existing its importance, the miasm. And I can predict this Jolie may get suicide, will try to get suicide. Why? Because the next miasm is syphilitic. If we shifted to syphilitic miasm from psychotic, definitely she will get suicide. And she tried once in the jail too. Okay, so that look to the. I'm not asking. I'm not. What to say is that I want to clear about the idea of the miasm, how truthfully miasm is occurring in the nature. That's why I use that's why I used these cases. Okay, so that's about the metorinum. And the other identification points of Medorinum. Biting nail. This is Saurav Ganguly, the captain of Indian cricket team, has always the tendency to the biting nail. That is an identification point of Medorinum. Okay, in carcinosin, I already said it is the skin tearing around around the nail. That is carcinosin identification point. Here, the biting the nail. And the procrastination. Postpone everything for tomorrow. And another remedy how same this procrastination, that is lycopodium. But in lycopodium, it is due to a lack of self-confidence like that. But in medorinum, it is due to a because of that hurriedness, procrastination. And the workaholic is a very workaholic medorinum. And the learning disability, dyslexia, especially when while making spelling mistake. While making spelling mistake, that is a field of medorinum. And hurried speech, hurriedness, like medicines like Bryonia and Hepasol, they have hurried speech. Okay, and another concomitant symptoms are forgetfulness is an important concomitant symptom in medorinum. And serrated teeth. If you're seeing serrated teeth in child, that's like we are seeing in the picture. That is an identification point of medorinum. Thick lip, that I described about Jolie and Suraj, that malicious people. Thick lip. And unibrow, if the eyebrows are joined. Actually, it is a psychotic symptom. If you are seeing the unibrow or a joined eyebrow, it means that it is an identification towards the medorinum. And nail depressed as if bent, depressed as if bent. In syphilinum, we have said the nails are distorted in shape. In medorinum, nail depressed as if bent. Okay, and better after a short sleep, like naxomica and phosphoric acid. After a short sleep, better. After a short sleep. And hair on unusual part. Some people have hair on shoulder or the back or some point of back, like some area, extrasomatic growth. If you, that means what? It's a psychotic feature. So even hair on unusual part, that is identification point towards medorinum. Okay, so that's about the medorinum identification points. Now we are moving to sorinum and another remedy. And here, the despair from itching. We know that the sorinum is preparing from the itch particle. Okay, and the fear of poverty, though he is well-to-do, her business will be very marvelously going, but he has always the fear that whether my business go to a failure or I'm going to be a poor. That means the pessimism is there. That is the apt word to describe sorinum. Two words are enough to describe sorinum: the sense of incapacity and the pessimism. That they have to always have the struggle of the survival. They always have the fear of getting failed in the business, failed in the love, failed in the life, or getting failed in everything. He has no optimism, not optimism even in a slight degree. He is the trademark of the pessimism. That's the soreness. Okay, and child good plays all the day. All the day child is very good, but troublesome and screaming all the night. Okay, all the night like jalapa, and the opposite is lycopodium. Okay, child could play all the day and troublesome and screaming all the night. That's about the sorinum point. Okay, and another points about identification points about medorinum, the eruptions behind the ear with intolerable itching. Identify the position ear for sorinum, ear with intolerable itching. And vitiligo start from the scalp and even the hair become white. Vitiligo start from the and hair become white, or the vitiligo. Okay, and the dysmenorrhea, we have a different medicine for dysmenorrhea, but here dysmenorrhea near climax, which is very uncommon. The dysmenorrhea during the early period of reproductive age period is common, but here dysmenorrhea near climax that is very peculiar, and the medicine is sorinum. And while taking the family history of strong psoriasis and eczema, in carcinosin, we have seen that a family history of the malignant disease. In syphilinum, we have seen that there is kind of many hereditary diseases. And in sorinum, the family history of psoriasis or eczema. And obstinate cases of bedwetting and constipation. We have enough remedy for bedwetting, like calcarea carp, like sepia, creosote, plendago, belladonna, restox. These are very much effective in bedwetting or the nocturnal enuresis. But if all these remedies are failed to control the bedwetting, think about the sorinum. And also the constipation. We have enough remedies like lactofloratum, opium, tarantula hispana, senna, cascara. We have a plenty of medicine, alumina, plenty of the medicine for constipation. If all other remedies to fail to manage the constipation, think about the sorinum. That, like what I said already, a miasmatic block is there. So use in the obstinate cases of bedwetting or the constipation, use sorinum as a remedy. And now we can move to another important medicine, the tuberculinum. My sir, Biju sir, always said the tuberculinum is his wife and syphilinum is his lover. That much he was that much fond of with tuberculinum and syphilinum, because that much witnessed the action of these much medicines, even in the genetic conditions like osteogenesis imperfecta and like that, with cured documented cases. That's why we are that much exciting about while we are saying about this kind of nosodes. When the tuberculinum, its nature is very clear. Tuberculinum means what? It is a combination of soric miasm and a syphilitic miasm. The syphilitic miasm means what? It is a destructiveness. Soric means what? A mildness. So it's a changeability. The destructiveness alternating with mildness. Destructiveness alternating with mildness. The child always want to bite and throw things. Intentional throw and biting. A problematic child. The tuberculinum child is like that. He don't like restriction. He don't like restriction. It's very impossible for him to obey an authority. That's why the tuberculinum is very much which is going to getting actions in problem disorders like oppositional defiant disorder, ADHD, and autism. They can't bear the authoritarian. That means if the teenage, if they feel that their freedom is get restricted, they will explode. Their character will explode. That means the destructiveness. That's saying that the person is the tubercular or the tuberculin remedy. Okay, always a destructiveness is there, like to want to bite and tear things, or always for tuberculinum, sleep is the waste of the time. For the tubercular child, they don't want to sleep. They always want to play with his choices, want to do something. The tubercular child. Skin allergy to milk and excessive growth of fine. Please note this: excessive growth of fine hair. While you're looking to the back of the back spine of the child, you can see fine growth. That is a confirmation point for tuberculinum or for the bacillinum too. Now, as a tubercular symptom, just remember, if you see excessive growth of fine hair on the back, that means that is that is the identification of soreness. Or symptoms change from one organ to another. Okay, symptoms change from one organ to another. Okay, and the constantly changing symptoms. The tubercular variety is that the changeability, while it is the dress or the food or about the relationship, everything, or about the job, everything, even is changeable. It's not static. One job for 3 weeks, then resign and get into another field. But they want change always. They want to explore the nature, explore the nature. Okay, and very hyperactive and always discontented. Always discontented is a tubercular feature. And another identification point, if the patient have the frequent cold, the bronchitis, asthma, and pneumonia, and it is an identification point of tuberculinum. Okay, we said if had the history of the cancer, that is carcinosin. If the history of the hereditary illness, that is syphilinum. If there is history of the psoriasis and eczema, that is an identification point of sorinum. Here we are saying not about the family history, but about the past history of the patient. If the patient have frequent cold, bronchitis, asthma, and pneumonia, that means something related with lung and upper respiratory tract infection, which is confirming that the patient is tubercular or the tuberculin. Okay, and this have the fear of the dog or animal, especially fear of the dog. But it's not a confirmatory, because in some tubercular patients have fond of animals because they love pets. But commonly the tuberculinum have fear of the dogs and animal. And another physical identification point, please just remember this. This all very often help to prescribe. Okay, their long eyelashes, silky hair, simply the dress and style often exhibited romantic and poetic sensitivity. That means by looking is a very graceful. That look to this picture. This is Hina Rabbani, the former foreign minister of Pakistan. Look, this is a tubercular. Look to her hair, silky hair. Look to the eyelashes. That is a long eyelashes. Simply a beautiful thing. The tubercular means beauty, and is another synonym of the beauty. If you have no case with no symptoms, just look to the patient, and there is a very long eyelashes and silky hair. And when looking the case, you feel that the patient has a tubercular tin or the tubercular history or the tubercular miasm. Just close your eyes and prescribe tuberculinum. Definitely act, because the homeopathy is the nature of this, is the science of the nature, the natural science. Definitely act. Okay, so another identification point, the worst form of headaches when other remedy failed. We already said about the worst form of bedwetting and constipation in the case of sorinum. Here, the worst form of the headache when other remedy failed. We have plenty of the medicine for headache, like iris versicolarius, scutellaria, melissa, asnia barbarata, and sanguinaria. If all these remedies fail, think about tuberculinum to remove that blockage. Okay, and stubborn cases of fever. If you are we tried all the fever remedy and the fever is still stubborn, like PUO, pyrexia of unknown origin, just give tuberculinum or pyrogen. Pyrogen is also a nosure. We will come into it. Okay, stubborn case of the fever. Think about tuberculinum. And the perspiration on nose. That's an identification point. Perspiration on the nose. Okay, identification. That's about tuberculinum. Okay, and I want to give another caution. Never give tuberculinum when there is massive heart pathology, especially in children. Okay, this is a caution. Just remember, if a child have a severe cardiac pathology, never prescribe tuberculinum. Okay, so that's about tuberculinum. And the next remedy and another friend of tuberculinum, that is basilinum. I don't know what's the role of basilinum in the rest of the world. In Kerala, what we did cruelly is that we are reserved basilinum for only for tinea. That is very unfortunate. Actually, the basilinum is a major remedy than tuberculinum. But we people are restricted basilinum for only for tinea. We think about bacillinum only for tinea. Tinea, that means a ringworm infection. But it is not like that. Bacillinum is a wonderful remedy. We can look into identification points. The quick answers and quick reactions in children. Quick answer, that means like Ignatia child. The quick answer and quick reactions. And physically, a small face with protruded malar bone. Malar bone is protruded. Natron cap also have this feature, the prominent malar bone. So in bacillinum, a small face with protruded malar bone. Okay, and it's very hectic. In tuberculinum, I said the changeability and the discontented is the feature of the tuberculinum. In bacillinum, hecticness is the keynote of the bacillinum. He always thinks, I want to do this or I want to do that. The time is too short. I want to do more things. This is always in the mind of the bacillinum personality. Very hectic. While looking to the teeth, you can see the yellow discoloration of the teeth. Yellow discolorations on teeth. That's an identification point. If you see a yellow discoloration of teeth, just start with bacillinum. Enough. It may act. Okay, and another identification points of bacillinum. The sleep as soon as the journey starts. It's a common symptom in child, right? Okay, but anyway, if a child have the tendency to always saying, oh, go outside. So when entering to the vehicle, they get sleep. As soon as the wind is blowing on their face, they get sleep. That is an identification point of bacillinum. Sleep as soon as the journey starts. Okay, and eczema around the eye. I want to ask a question. Eczema around the ear, which was that remedy? That was sorinum. Ear, sorinum. Eye, bacillinum. Look how beautiful materia medica is. Okay, and if the history of the lots of warts. Okay, we have the tendency to think about tuja if the patient has a lot of warts. But if the patient has a history of lot of warts, also think about tuberculinum into action in your thought. Okay, and children start hitting their head. It's a common thing. When they get angry, some children have the tendency to hit their head on the wall. That's a feature of the bacillinum. In syphilinum, also I said about they have the striking. That is the destructiveness. In here, bacillinum 2, it's a tubercular. That means a small part of syphilis is there. Some kind of destructions will be there, but mixed with some kind of sora. That's the beauty of tuberculinum and bacillinum, right? Okay, so if the children start hitting their head to the wall or to the floor, that means that is a bacillinum child. Okay, and but we can look to the identification clues of bacillinum. A shiny nails. In medorinum, I said nail is bent. In syphilinum, I said nail is distorted. In bacillinum, nails are shiny looking nails. It's like oily appearance. And hairy back on the hair. In tuberculinum, 2 that have hair. If the back is hairy, think of 2 medicine, either tuberculinum or bacillinum. But confirm the possibility of a tubercular miasm. Okay, and history of the recurrent worm and history of the TB that confirm the bacillinum. And irritable, snappish, and uncivil children. And here, and fear of the black dog. In tuberculinum, I said fear of dogs and animal. And bacillinum 2, they have the fear of the dog, especially black dogs. Okay, so that's about bacillinum. Now we can move to another nosode, that is lysinum. We know from where we are preparing lysinum. That is from the saliva of the rabbit dog. Okay, some patients have the tendency to spasmodic spitting or while he is walking, spitting to the street. That is a third person report complaint. Okay, it is spasmodic spitting. That is a lysin symptom. And difficulty in swallowing, difficulty in dysphagia, it's a hydrophobic symptom. And aversion to coition since delivery. Okay, so just remember this symptom, spasmodic spitting and aversion to coition since delivery. Okay, and another important symptom, in bacillinum, I said the child has a tendency to strike the head. Okay, in the lysinum, another important symptom, often bite to show their anger. The child have the tendency to bite, or bite the mother, or bite the brother, or bite to them who irritate him. Who irritate him? Definitely he will bite. Okay, so often bite to show there. Okay, so if the child has a tendency to bite, lysinum. If the child has tendency to strike his head on the floor, that is basilinum. Remember this. This will help in the definitely in the different cases. Whatever may be the diagnosis, whatever may be the symptom totality. If your patient has this kind of symptom, it's saying that nature saying that this child is basilinum or this saying this child is lysinum. It is our duty to spot this child has the symptom, and this is a confirmation point of tuberculinum or basilinum. Okay, so that's about lysinum. Okay, and valuable remedy in uterine prolapse. Okay, just remember about the valuable remedy in uterine prolapse. That's about lysinum. And now we can move to another remedy, that is ambragracia. We know the ambragracia, where the ambragracia is preparing. It is from the morbid stomach content of the sperm whale. In ambragracia, that is the auditory hallucination, as if ticks of watches, the auditory hallucination. And embarrassed face, we can come to that. And formic sensation in the thyroid gland. Ambragracia is a wonderful remedy for thyroid complaint, especially like Hashimoto's thyroiditis and other thyroid complaint. Why? The ambragracia is a psychotic remedy. That kind of suppression is there in ambragracia. So, okay, and the auditory hallucination and if the formication sensation in the thyroid gland, that is an indication of ambragracia. Okay, and we can come to what is the pathogenesis of the ambragracia. That is a sense of embarrassment. How this embarrassment happened in the ambragracia? You know why? The ambragracia have a feeling that is a feeling of shit feeling. I'm not good. I'm not good to look. I'm not good to go to public. I'm not good in studies. I'm not good in business. I have so many weakness. I have a shit feeling. So what will she do? She know that I'm very I'm very ugly. So what she will do? She think I want to cover up all my weakness. For what? If I get exposed, I get forsaken from my beloved ones. So her motive is to cover up all the weakness. We are very familiar about one of the symptoms of ambragracia. That is a sense of a tremendous shyness in the presence of others. How this symptom develop? Look how homeopathy, Materia Medica is beautiful. How this tremendous shyness develop? Because of this sense of embarrassment. I'm not good. I'm not going to appear. I'm not good to appear in the public. That causes tremendous shyness in the company or in the presence of strangers. The Barretta cup also have this tremendous shyness in the strangers. But the pathogenesis of the Barretta cup and ambragracia is different. In Barretta cup, that is an incapability. That is an inborn error, genetic error. But in ambragracia, it's an acute feeling. She is not like that actually. She don't have that incapability like Barretta cup. But she thinks so. It's an acute feeling. Look, this is the way to differentiate the remedy. Just forget about the diagnosis of the disease, about the symptom totality. If you are unable to diagnose the state of the patient or the state of the mental pathology, it's very easy to prescribe the remedy. So that's about the ambragracia, a sense of embarrassment. And another remedy very close to ambragracia is the lacaninum. Lacaninum is not a nosort. Actually, lacaninum is a sarcode. That's from the dog's milk. In lacaninum also, there is a dirty feeling, but the pathogenesis is different. How the lacaninum pathogenesis develop? In lacaninum, the lack of self-esteem, self-worth aroused after a cruel comparison with other people. Let me to explain. For example, in a family, there are two children. One child is very good, smart in studies, and another is not good in studies. So what will going to happen in that family? The parents are used to reprimand this child or curse this child by saying, oh, you look to that child, look your sister, how good she is, how poor you are. This is the common terms or the common points every time she heard. What causes? This causes an embarrassment. This results in the lack of self-worth. So in Lacaninum, there is a person responsible for that lack of self-esteem. But in Ambragresia, it is the self-arousal. It's a self-eliciting one. In Lacaninum, there is a person responsible for that patient state. That is revenge or that hatred for that person will be there in Lacaninum. I think it's clear. Lacaninum and Ambragresia is clear. Dear friends, always try to understand medicine like this. Don't go to by heart all the symptoms of the medicines. Instead, just to try to understand what the pathogenesis is. It's help to diagnose the remedy. Okay, so that's about Ambragresia. And next one, the pyrogen. Okay, in pyrogen, we know we are using the pyrogen. We know it's a septic origin. While the whispering herself while narrating the symptom, there is a whispering, narrating the symptom. While the narrating, we can feel that, oh, who is whispering? Same patient is there. That is the pyrogen. And pain right shoulder while coughing. Okay, and this is the most identification point of the pyrogen. This pyrogen child can think and talk faster than ever before, especially during fever. That means actually what happened, we are expecting child become lethargic or weak by a fever or get a viral infection. But in pyrogen, what happened? The child get very energetic and get talkative and singing song and dancing and always very exciting during fever. We may think what happened to this child. But what the homeopathic nature is saying is a confirmation point towards the pyrogen, a sense of well-being even with high temperature. A sense of well-being even with high temperature. That means that is the confirmatory point of pyrogen. Okay. So okay, in earlier I told about a stubborn case of the fever. You can select pyrogen. If pyrogen fail, you can use tuberculinum. Okay. And the next one, influenzinum. I'm not going to the symptomatology of the influenzinum. Instead, I want to say one symptom that is get unnoticed. That is obesity in children from early thyroid dysfunction. Obesity in the children from early thyroid dysfunctions. Okay, think about influenzinum. Okay, and now the variolinum. Actually, we are using variolinum for as a preventive for chickenpox or as a medicine. But I'm not going to say about that variolinum's actions on chickenpox. Instead, I want to say one thing, a calcaneous deposit on spinal cord. Remember, on spinal cord, not on the vertebra. If a pathology is the developed is a calcaneous deposit on spinal cord, the variolinum may come into play. Okay, so in cervical spondylosis or lumbar disc prolapse, if all other remedy fail, like calcareca, acid phosphorus, silesia, or lactananthus, they have the medicine for cervical spondylosis. If it get failed, think about variolinum and lumbar disc prolapse, the backache. And even in the chickenpox, if the patient has the concomitant as backache, the variolinum is a sure remedy, no doubt, guaranteed. You can close your eyes and prescribe. Okay, so remember in variolinum, cervical spondylosis and lumbar disc prolapse. Okay, and next one, the parotidinum. We know from where we are preparing the parotidinum in progressive muscular dystrophy to reduce the CPKMB. Okay, we know that in progressive muscular dystrophy like or Duchenne muscular dystrophy, while we are looking to the blood parameter, will be increased CPKMB. So to reduce the CPKMB, we can use the parotidinum. Okay, and this is the experience. It is experience from Dr. S.G. Biju. Okay, and it is well known from the carcinoma of the head of the pancreas and useful in azoospermia. It is a wonderful remedy in managing infertility. Okay, we know that if get mumps, there is chance to affect the metastasis to the testis. Okay, if it happen, the parotidinum is useful in azoospermia. Okay, and another remedy is the staphylococcinum. We know what is staphylococcinum. Okay, impetigo contagiosa. That is one of the disease that that is amenable to staphylococcinum. Okay, and diarrhea after decayed food. In Kerala, there is an Arabian food known as shawarma. I don't know whether all are familiar about it. Shawarma is actually Arabian food. Actually, it is a decayed meat. Even that recently in Kerala, death has occurred in Calicut district. One child died from food poisoning by eating this shawarma. If it is diarrhea from shawarma after decayed food, staphylococcus is coming into action. Always remember, a decayed meat or decayed or putrid meat or contaminated meat, that is the role of staphylococcus. Okay, and if the skin have any suppurative pathology, remember, if you are taking a case and you are seeing a suppuration is there, that is an identification towards staphylococcinum. And recurrent pus is the key point. Recurrent pus is the key point of the staphylococcinum. Okay, and the next one is the streptococcinum. If the patient ASO is high, we are usually using Stellaria media for increased ASO titer. Also we can use streptococcinum, the rheumatic fever. Okay, the rheumatic fever pathology. Okay, and in streptococcinum, the identification points are recurrent throat infections or boil. Recurrent throat infections or boil. And also in septic fever or in any septic state when pyrogen fails. We are discussed about stubborn fever. If pyrogen fails, we think about tuberculinum. And also if pyrogen fail, we can think about streptococcinum. And even in post-viral arthritis. Okay, I just want to share with you something. And streptococcin is very much effective in the case of osteoarthritis. Is the pathology, is the symptomatology same as that of Rustox? If you didn't get any result with the Rustox of your patient, just try streptococcin 200 in your patient and see the result. Okay, and the entry point of the streptococcinum is that 3 points. Okay, if the patient has the involvement of the throat, heart, and the joints, if the patient has symptoms of the throat and the cardiac, the heart, and the joint, it is a confirmation points towards the streptococcin. And you can also get another clue. You just ask about the maternal history or the pregnancy history. If there is recurrent infections during pregnancy for mother, that is an indication of streptococcin for child. If the mother has recurrent infections during the pregnancy, that is a confirmation point for the streptococcin. Okay, so what are the entry point of streptococcin? If the symptoms have this triad, throat, heart, and joint, and the one other confirmation is that if the mother has frequent infections during pregnancy. Okay, that's about streptococcin. And next one, the malaria nosort. And another symptom, that is refuse to eat because he believes that eating will cause illness. That's a strange symptom. That is, there are people, or especially girls and ladies, that they refuse to eat because they fear that they put weight. For that, they avoid eating. Not like that. Here, they refuse to eat because he believes that eating will cause illness. That's an indication of malaria nosort. And also another point of malaria nosort is that should be thought in worst cases of chikungunya and dengue fever when associated with rheumatism. And the few years ago, the Kerala have the epidemic of both chikungunya and dengue, and we homeopaths are brilliantly managed both dengue fever and chikungunya in Kerala, and that's are well documented in Kerala too. Okay, so in case of we have medicines like eupatorium, like eupatorium and Rustox and X-ray, like medicines are there, but in a worst cases of chikungunya and dengue, when associated with rheumatism, we can think about malaria nosort. Okay, and another symptom is eye feels heavy and burn like fire. Eye feels heavy and burn like fire. That's the exact symptoms of eupatorium. Okay, and next one, the melandrinum. Okay, melandrinum is the raggot to remove the raggots in the ulcer. That kind of a pyogenic presentation. And it's clear the remnants of the cancerous deposit, remnants to clear, and also to prevent the metastasis in the malignant cases, we can give melandrinum 200 to that patient. And also, you may use the prophylaxis for chickenpox. In Kerala, we are using the malandrinum as a better preventive for chickenpox than the Rextox or variolinum and pulsatilla. The malandrinum is highly effective as a prophylactic remedy for chickenpox than Rextox and pulsatilla. Okay, so that's about the malandrinum. And the next remedy, that is aviare, aviare 30 is like tuberculinum. And the aviare, some patients, especially some children, have the tendency to develop recurrent respiratory infections. They get 3 or 4 infections every month, 3 or 4 infections every month. To remove that dyscrasia, use Avere 30, Avere 30, recurrent respiratory infections. And you can also, if the child has a recurrent respiratory infection, 3 medicines are coming into play. One is Avere, another one is Acidate and Thymus. Acidate 6x and Thymus vulgaris 30. Okay, but Dr. Biju sir is used to say that the as iodide is not that much effective in coastal area. In our Kerala, there are many coastal areas out there. The as iodide is not that much effective in the coastal area. So we'll shift to Thymus vulgaris or Avera 30. Okay, so if the patient has a recurrent child has a recurrent respiratory infection, think about these 3 remedy: Avere 30, Thymus vulgaris 30, and Acidate 6x. Okay, so and this Avere 30 follows Acidate and Thymus well, and you can clear this tendency, or you can save the patient from getting recurrent respiratory infections. That's about the Avere. And the next one is the epihisterinum. The epihysterin means that's a remedy that is preparing from the fibroid tumor, the uterine fibroid. Okay, so you should think of this remedy when your well-selected remedy fails in fibroid, endometriosis, or the malignant sufferings of the uterus. Okay, if your well-selected remedy fail, you can think about epihysterinum. Also, if your patient has severe hemorrhage from the fibroid growth, actually the medicine is a trillium pendulum. If the severe hemorrhage from the fibroid, trillium is a medicine. If the trillium is not acting, you can think about epihysterinum. So just remember, epihysterinum action is on the uterus. In the case of the fibroid, or in the endometriosis or the malignant affections of the uterus, when your well-selected remedy fail to act. Okay, and next one is the B. coli. B. coli. And B. coli 200, we are used to remove the recurrent UTI. Remember, B. coli is not the medicine for urinary tract infection. We have plenty of the medicines like Mercocor, Cantharis, Sarsaparilla, Berberis vulgaris, and Equisetum. There are many medicines for urinary tract infection, UVA-UC, UTI. But some ladies have the tendency, like we are said about the children. If children have the tendency to develop recurrent respiratory tract infection, some ladies have the tendency to develop recurrent UTI. Okay, this B. coli will definitely prevent the tendency to develop recurrent UTI. Okay, so that's about the B. coli 200. Okay, and enterococcinum. Okay, enterococcinum. And just remember that is action is on intestine if the patient has the emotional diarrhea, especially in irritable bowel syndrome, ulcerative colitis, and proctitis. It is exactly similar to a bowel nosode that is known as psychotic compound. I will talk about psychotic compound. Enterococcinum is somewhat related to psychotic compound. Okay, so then the hypoxanum. Hypoxanum. Okay, this is known as the anti-tart of old age. Why? Because we know about the symptoms of anti-tart, that much accumulations of the mucus in the lungs, and as if much would expectorated, but nothing comes up. Okay, we are using the medicines like Senega or Eridictione to remove that phlegm. Okay, but if it is an old age, remember hypoxanum. That is a better remedy than Senega and Eridictione in old age. Just remember this, anti-tart of old age. Which is that remedy? Hypoxanum. Okay, and another one, this dysentery compound. I think while saying enterococcinum, I use the word psychotic compound. No, it is dysentery compound. Dysentery compound. It is a bowel nosode. It is a better remedy for irritable bowel syndrome and morning diarrhea. I have a clue. Just forget about all other symptoms of the dysentery compound. Only remember one thing. If any of the mental strain aggravated the symptoms of the digestive tract, that is the action of the dysentery compound. Whether it is irritable bowel syndrome or irritable bowel disorder like ulcerative colitis, Crohn's disease, proctitis, or enterocolitis, or enteritis, whatever it may be, if a mental strain is aggravating the digestive tract symptom, think about the dysentery compound, the bowel nosor. It's an action, definitely it will get act. It is closely resembling with enterococcinum that we discussed earlier. The morning diarrhea and irritable and all the IBS, irritable bowel syndrome. Okay, I repeat, just remember one symptom in dysentery compound. Any of the mental strain, whether it is anticipation, anxiety, grief, worries, or anything, if it aggravate the digestive symptom tract, that is the confirmatory point of dysentery compound. Okay, and the last one, the serenum, that is the carcinoma of the breast, liver, and colon, and the lancinating pain of the cancer. Okay, just forget about the symptomatology of the serenum. We had discussed the carcinosin in very detail. If you have a case and you get a resemblance that the patient is somewhat like of carcinosin, but the nature of the tumor is very hard and have the stomach symptoms of sulfur, that means hollowness or emptiness in the abdomen, with history of the worms, it is a confirmatory point of serenum, not carcinosin. The serenum is the remedy for that patient. I repeat, exactly all the symptoms that of the carcinosin, plus the tumor is harder or the calcification is there, with stomach symptoms of the sulfur, with history of the worms. Okay, and talking about the adaptability of the serenum in the malignant condition. We are not only using the serenum in malignant affections, we are also using serenum in worm complaint, if Cinna or Tucrium are failed in cases. Okay, so if your malignant patient have a history of the worms, has the symptoms of the sulfur, has hollowness or emptiness in the abdomen, with the hard tumor and the features of the carcinosin, definitely that is the serenum patient. Prescribe serenum with full confidence, it will get some relief. Okay, that's about the nosode. I think it's a very short time to explain. I know that I'm very I'm very explained, it's very speed, but just to forgive me, I want to share more points with this short time. That's why I used to speak in very speed. Okay, I think that's about the serenum and about the nosodes, and all I explained, it was about that the knowledge that I conceived from Dr. S.G. Biju, and I think it's beneficial for you. And Dr. Karthik sir, thank you so much for giving the opportunity for a talk. Karthik sir, please.
Dr. Wahab, it was such an amazing lecture, amazing 1.5 hours. I just didn't know this. We spent 1.5 hours on this subject. You kept us, so stuck to the screen that we were just absorbing everything that you were saying. So it's amazing. So I'm now asking people from the attendees or the attendees if you have anything to ask Dr. Wahab, from his talk. You can just type it in the box, and I'm going to share that so that everybody can see what you've asked for. And
sir, there's one remedy. One question was, what was the remedy when you mentioned you used it for COVID-19? In India, actually, we are not treating the COVID. In Kerala, we not have any permissions to treat COVID. But here we are using medicine Asal 30, and we are using the term immune booster instead of prophylaxis. And another part of the states, they are treating the COVID with homeopathic medicine, like medicines like belladonna and phosphorus and bryonias is coming into play. And another about the asal, asal, why I'm saying about asal, arsenical, okay.
Right.
And one thing I have to share is that in Kerala, we had conducted a study about ASAL, about its immune modulations. And we are experimented in 15 patients. And what it found that after giving ASAL, the patient's immune modulators like CD4, CD8, and its ratios are increased. That means the ASAL have the power to modulate our immunity. Okay, and we know that it's a very primitive study, and we have to continue on. We hope we will do best in the coming eras.
That is a very good study, doctor. I saw that study. It's an excellent study that you've done on ourselves. There's one more. Any experience? Vishaka is asking any experience with herpes nosodes.
Herpes nosode means, which is that, doctor, whether they are using variolinum.
Yeah, I mean, I don't think there is a herpes nosode as it is available in the market.
Yes, yes.
Yeah.
Yes, I
So
don't know.
I'm
I
not
think
sure.
they may be asking about variolinum. Okay,
Variolinum.
right?
Okay.
The variolinum. I described it as a variolinum. The variolinum is we are usually giving as a prophylactic and also for the medicine for the chickenpox. But the exact the unexploited area of the variolinum is the backache. Okay, in the especially cervical disc cervical spondylosis or lumbar disc prolapse. Okay, if any of all of your better remedy failed in cervical spondylosis or in lumbar disc prolapse, you can think about the variolinum. And also, if your chickenpox patient have a concomitant as backache, the variolinum is the sure shot.
There's one more. Which potency of hypoxanum for old age chest with
200, 200, 200. Hypoxanum 200.
other bowel nosodes experience? I
In
think
short,
that's
I
another.
don't. Oh, hi. Actually it's another topic is a bowel nosode,
Yeah,
and
true.
I don't have much experience with bowel nosode, but Libin Job is my friend. I can promise
I know.
that I will come into with you with the experience of bowel nosode, and after 2 or 3 years, because I want to exploit it. Now I don't have much experience, but Dr. Biju sir and the Sahyas using the dysentery compound that I mentioned in our module, the dysentery
Right.
compound, that is very much useful in controlling emotional diarrhea or irritable bowel disorder or irritable syndromes or irritable other disease like ulcerative colitis, proctitis. Okay, only the symptom you have to notice is that if the mental etiology, if any mental strain, that means any anticipation, anxiety, grief, worry, or whatever it may be, if any mental strain is aggravating the digestive symptom, that is a confirmation point of the dysentery compound. Okay, so use that. Okay, that's about, I know only about the bowel nosode and I have only running knowledge about it. And chlamydia wise matorinum, I don't know what's their uh, chlamydia. I don't, whether you asking about its efficacy in gonorrhea. Karthik sir, I didn't get what they are aiming. Chlamydia
Uh,
was matorinum.
no, I think she wants to compare the two remedies. Do you
I
have
don't know about the chlamydia. I don't
about?
know about.
Okay.
I don't know about.
Okay. This is something which is interesting. What is a potency would you would generally use?
Then use with no sir. Okay, and this is the main question that we are always facing. Okay, just remember the potencies, and especially if in the beginning I said about to remove the blockage in a case, that means to case the intercurrent. Okay, in that case the better potency is the 1 the cephalininum 1 or tuberculinum 1 or medorinum 1. Okay, and in also, if our case symptom totality is much resemblance to the remedy. For example, if I had narrated how the carcinosin patient is like that, if that kind of 60 or 70 percentages of symptoms are present in your patient, you can use 1 Okay, if is not that much kind of similarity to the person, you can use the 200, because the 200 potency is the best potency to watch the action of the medicine. Okay, if you didn't get an action after 2 weeks or 1 month, you can increase the potency. Okay, and then about the repetition, there is no need to repeat frequently. Okay, just take at least 2 weeks to repeat the medicine if you didn't get the action. If you get an action, just put on the SL and wait for 1 month. Okay, the 1 m is enough. The nosodes are enough. Just remember, our nosodes are noxious substances. If it get acted, that 1 dose is enough. If that nosode is not your patient's remedy, there is no use by repeating it very frequently. It's only wasting the time. Okay, so just remember one thing, just look to the totality of the case of the patient and have a resemblance and look to the intensity of the resemblance with the medicine. If it is high, use potencies like high potency like 1 m. If it is not, is only a just some clues are there, use 200 potency to watch the action of the medicine.
Yeah. This is the next question. Could you mention nosodes made from pituitary? Have
No,
you?
doctor, it's not only it's not a nosode, it's a sarcode. It's not
It's a
nosode.
sarcode. Yes, it's a
It's
sarcode.
not nosode. Mhm.
Okay, so Dr. Libin again wants to ask, can we start with nosodes?
Which means, yeah, definitely,
Can you?
why
Yeah.
not? Well, yeah, no, I got it. Yeah, definitely, we can start with nosode. If you have if you are treating for a problematic child, if you have a attention deficit hyperactivity disorder or autism, and while taking the case, we get all the picture of the tuberculinum, like as a problematic child, and is the changeability is there, and the destructiveness is there, and the long eyelashes is there, and silky hair is there, and or the fear of dog is there. And if it is entirely fit to that case, tuberculum is that patient's remedy. So it's very cruel to prescribe another remedy for our sake or for our happiness. It's a cruel thing. Okay. If the patient is tuberculinum, just start tuberculinum. Nothing going to happen than a good thing.
A picture I would like to know. Case of fissure on tongue. It given phosphorus with slight red
Okay, a
odor.
case of Fisher phosphorus. I don't know whether the patient is phosphorus or not. If the phosphorus, if you're confident about the phosphorus, just stick on it, either increase the potency, or otherwise you can think about the Mexol or acid nitricum, then go to syphilinum. Okay. It is good that you are pointed it is that syphilitic. We are not only have the syphilinum as syphilitic remedy, the Mexol and acid nitricum also are coming under syphilitic miasm. For the crack in your tongue, I hope it's a deep crack. If it's so, use before syphilinum, you can use the Mexol and acid nitricum. If it is not acting, go to syphilinum.
How frequently can we repeat tuberculinum?
Children, if symptoms, no doctor, the repetition is there is no hard and fast of all repetition. Just remember one thing, if the medicine is acted and if your patient is improving, there is no need to repeat the same medicine. Okay, just wait, your patient will recover. Okay, if your patient has no improvement, then you can repeat either the same dose of the medicine or you can increase the potency of the medicine. Okay, don't be hesitate or don't be very feel very rough and tough about the repetitions. Okay, just go to the just look to the sake of the patient. If the patient is on improving, no need to repeat. Don't spoil the case. Just put on SL and wait for it. It will bring cure.
You said about eccentric. Which potency for
200,
diarrhea?
200, 200, 200.
200. I think that's about it. There are people asking about Sylvia. All our webinars are recorded. You can have a look at all our earlier webinars. Let me just type it out for you. You can have a look at it at ilovehomeopathy.com/webinars. And let me just type it out for you. So, where's that? Yeah. all our earlier webinars that you may have missed, you want to see it again, you want to go through this will also be up in a couple of days, so you can always go back and have a look at it. Libin, we go on to the next question. Which book to refer for no swords? Oh, no.
Okay, which book refer to for nosod? And one thing that is the first thing Dr. S.G. Biju taught me is that is the better book for us is our patient. Okay, so just concentrate on your patient and study for your patient is the better thing or the best thing to remember. Okay, if you are depending on the books, it's like watching movies or songs. Okay, because after a few weeks or a few months, it get volatile. Okay, but if you are reading for your patient, one of your patient, it will be there in your mind. Why we are remembering carcinosin or tuberculum or syphilinum that much? Because we are using for our patient. But why we are not much aware about the bowel nosot? Because which are not used about in our life, even in the once in our lifetime, though we are studied in the college time. Okay, so always study for the patient. Always, either it is a remedy or which is you are going to study a condition. The best thing is to study for your patient. That's the better thing. Okay, as your question is the nosot, I can tell me some books that one book is that by Dr. Gaurang Gaikwad. That is a very good remedy. That is the Materia Medica of nosodes and sarcodes. That is a very good
Sarcos.
book. And that is another also books by Dr. Soul of Remedies by Dr. Rajesh Shankaran. There's a brilliant explanations of all important nosodes are there. Okay, but in every book, whatever may be the book, the better thing is read it for your patient. If so, it will be in your mind forever. Otherwise, it's get volatile.
This is Janasina. What potency will you use for arsenic? This is what the government recommends.
Oh,
The Ayush.
okay, doctor. We are using a Salb 30, one dose, and for one dose every day for a continuous 3 days, and we will repeat a Salb 30 after 1 month. Okay, that's now the potency we are using. That's a proposal by the Indian central government. Okay, so that's we are using in every state.
I think we'll stop at the last one. Shobha Vasa has asked how to give thyroidinum in thyroid patient.
In thyroid
Do you
patient,
give?
and if okay, thyroid patient, if the case is hypothyroidism, use thyroidinum 1 Okay, if the case is hypothyroidism, you can use, sorry, if your case is hypothyroidism, you can use thyroidinum 3x. If your patient is hyperthyroid, you can use thyroidinum 1 Okay, that's about one clue.
Yes. Any experience with insulinum?
No, doctor, insulin is a medicine. Insulin 6C is a very good for diabetes mellitus. Insulin 6C by one of our guru, Dr. Mubarak ji. But personally, I'm not using insulinum, but we have other remedies for diabetes mellitus. If you want to use insulinum, use 6C, insulinum 6C.
6C. Yeah, I think this is what most of for thyroid. Yeah, I think you've answered all the questions. Could you list the books mentioned, please? Jan, I'll email you the list of books. I think the books are available on some of the sites. I'll email you separately on the list of books available for no swords. Other remedies for DM.
Diabetes mellitus, other important medicines are for like Abroma augusta. Abroma augusta is very good medicine. And if your patients have any skin complaints, you can use Zygium jambolanum. If the diabetes with any other weakness, you can use acid force. If the diabetes with impotence or any other sexual dysfunction, you can use Helonius or Coca or Moscus. And these are the specific remedies, and also Cephalandra and Gymnema sylvestre, these are also coming into the actions of the diabetes mellitus. But this is only to manage, but to cure or to, it's a potentized medicine, that constitutional medicine like lycopodium, medorinum, and carcinosin, and natron sulf 12x. 12x is the best potency to control. These are the remedies which we are using. There are enough remedies for.
I think with this we'll shut this session of the class. I think it was an extremely informative webinar. It's too short a time. I know that it's just too short a time for such a beautiful subject. We hope to have you once again with us. Maybe one or two nosodes. We can cover one or two nosodes on another day. What, Dr. Wahab?
Definitely.
Can we do that?
Definitely.
Yeah.
Oh, definitely.
Yes, and we'd also like to know where we can contact you. Do you have an email address? If you can just tell me, you can type it out.
Yeah.
On the
My email ID is
email ID.
abdulwahabcp@gmail.com.
Okay, I'm just going to type it out for you. Abdul,
Yes, yes.
P-A-H-A-C-P.
Abdul Wahab CP. Yeah, I will type. I will type.
Okay. Yeah. If there's anything you'd like to know, you can contact him. You can email him, abdulwahabcp@gmail.com. abdulwahabcp@gmail.com. And so this is with this we come to an end of an excellent webinar, and I hope there was a lot of things that you learned today, and hopefully you'll start to use no swords in your daily practice. We've been encouraged now by Dr. Wahab to use no swords with the wonderful results he's got. I should also thank Dr. Biju, because Dr. Biju gives me one speaker every month. So if you want to know what kind of work he's been doing over the months, this is an example. Dr. Wahab is an example of what Dr. Biju does at Sahia. So I encourage you to join the group, follow them, follow their courses. They're also starting a research section of Sahia. So if any of you are interested to join them in research in any manner, whether you just like to learn about research, whether you'd like to participate, or you just like to know how it's done, you can. Yeah, Sahia, does it have a website, doctor? I think they have a
Actually,
Facebook
we have
group. They have a website.
FB page. We have
Yeah,
a FB page in that name is Sahia.
Sahia.
You can
Yes.
join it. Sahia.
Yes, you should join, and maybe I will send out that link that Dr. Biju shared with me, where if you want to volunteer into the research group, you're interested just to know about it, you can just fill up a form, and they will get back to you. And yeah, so this is so much about Sahia, and hats off to them. They're building a nice army of homeopaths who are going to go out and cure everybody in Kerala. So, with this, I thank you, Dr. Wahab. Wahab. Thank you so much for the knowledge that you have shared with us. We hope to have you back very soon with another two nosodes, maybe, especially. And we will send you a feedback link, and we have been sending a few emails with the feedback link. So kindly let us know how you liked our webinars, what you would like to see more. Did you learn anything? Or is there somebody you want us to host on the webinar? So we will talk to them and ask them to come and share their knowledge with us, so that we can all learn from their experience. So with this, I say goodbye to everybody. Goodbye, Dr. Wahab. Thank you so much once again. And we hope to see you again, right?
Thank you.
Thank you, everybody, for coming in. And we hope to see you next Wednesday and Thursday. Stay updated. We'll be posting the webinar. 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 We'll be pos We send out mails now to whoever's registered with us for the webinar. If you know a friend who wants to join these, you can ask them to go to our website, www.ilovehomeopathy.com. Ask them to just enter their name in their in the webinar form, and we will send them emails about our future webinars. So thank you so much once again, and we hope to see you next week. Till then, stay safe and see you all. Good night, everybody.
Good night. Good night.
Good night, doctor.
Good night.